need to panic. That's word from Wake County health leaders after the first confirmed case of the coronavirus in the state. And here's what we know right now.
They say it's an isolated case, and he is in isolation at home. At least 10 people have died so far. 9 are from Washington State and a new one from California. There are 3,200 deaths worldwide. CBS 17 has team coverage from how COVID-19 is impacting events in the Triangle to what it's doing to your wallet.
But we start with CBS 17's Colleen Quigley, who was at today's press conference. Colleen.
Yeah, Angela and Marius, and since the news yesterday of the state's first presumptive case of novel coronavirus, so many of you have asked for more information about the whereabouts of this man once he was diagnosed, or before that, the flight he was on. That's something we really wanted to press health officials about today, and what they told us is they are learning more and more about COVID-19 every day, so they have to follow the protocol for what they know right now. County health officials say the man who tested positive for the state's first presumptive case of novel coronavirus is doing well, resting comfortably at home. But the news of the disease in the county has some worried if they could get sick. So I asked county health officials.
Did they come in contact with this person at church or at the gym before they started feeling sick or before they knew they were sick? What are you saying to those people, and has the county reached out to any of those people?
Yeah, so current guidelines from the CDC indicate that we need to be reaching out to individuals who were in close contact with that person when they became symptomatic. And what we mean by close contact at this time is individuals who were within 6 feet for around 10 minutes or more.
Public health officials say they are actively reaching out to people who came into close physical contact with the patient while he was symptomatic. They stressed that does not include people who were on the flight from Washington State to RDU or in the airport on February 22nd, because the man was not showing symptoms at that point. Health officials say once the patient started feeling sick, he stayed home. Then after a few days, contacted his doctor.
I know you said they stayed at home. Was that all they were doing? Did they stay at home for that entire week time? Is there any more light you can shed on what they were doing during that time?
Yes, so as I stated earlier, there are some pieces of information that we're following up on because they had reported some activity in terms of that time frame that you just described. And we're doing that active outreach.
Health officials say once they've identified the possible exposure those people face, they place them into different risk levels.
We instruct them on how often they should be taking their temperatures. We instruct them on whether or not we would have a staff member that would be actively calling them, or whether or not they would be more passively calling us if they were to have a concern.
Now, a couple of things we want you to keep in mind. When we say presumptive, that is because we still need to get official confirmation by the CDC lab who is testing this sample. Now, the other thing to keep in mind tonight is that the county is calling this an isolated incident. This person who is diagnosed, they are at home in isolation. We also learned today that their family who lives in the house with them is being quarantined for 14 days. And the big takeaway that I got from today that we want to pass along to you guys, health officials are asking everyone, please do not panic. That does mean, though, you should be taking precautions, washing your hands, avoiding touching your face, and staying home if you feel sick. Reporting live in Wake County, Colleen Quigley, CBS 17 News.